afternoon, esteemed Board of Dentistry members. I'm Dr. Becky Smith, and I'm the president of the Florida Dental Hygienists Association. Florida Statute 466.023, subsection 1, provides the Board of Dentistry the authority for the delegation of root planing and application of topical preventive or prophylactic agents. According to Goodman and Gildan's text, the pharmacological basis of therapeutics, often called the Blue Bible because of its importance and use by pharmacy schools, a topical medication is, quote, a medication that is applied to a particular place on or in the body as opposed to systemically. Most often this means application to body surfaces such as the skin or mucous membranes to treat ailments via a large range of classes, including creams, foams, gels, lotions, and ointments, end quote. By definition, like locally applied antimicrobials fall into this class of medications because they're adjuncts to preventing periodontal disease from worsening, and they're applied within the pocket to the junctional and sulcular epithelia. As Ms. Cavanzone cited earlier, in 2011, ADA's Council on Scientific Affairs convened an expert panel to conduct a systematic review of the literature to develop a clinical practice guideline on non-surgical treatment, including scaling and root planing with or without adjuncts for patients with any severity of chronic periodontitis. The findings were published in the July 2015 JADA. I have the article with me if any of you would like to read it. The findings determined that, quote, the potential for adverse effects from root planing was negligible, end quote. The effects from locally applied antimicrobials spontaneously resolved within a few days or were mostly mild and transitory. I trust that this board makes decisions based on the scientific evidence and not anecdotal personal stories. 43 states and the District of Columbia authorize dental hygienists to perform root planing under general supervision. The approved rules changes from December provide Florida dentists with a less restrictive supervision option to authorize within their practice and allows each individual dentist to determine the delegation and supervision of these remediable tasks within his or her own practice. The Florida Dental Hygienists Association submitted supporting documentation from a national insurance company. In its 2008 letter, Marsh Consumer wrote that neither the existence nor absence of dental supervision affects insurance rates or availability. In fact, in 2017, Mercer stated that nationally they have not seen any increase in claims or actions against dental hygienists practicing under general supervision. By virtue of their license, dental hygienists are individually accountable for the care and services that they provide and for upholding the standards of care that define and guide professional practice. Since 1985, FDHA has had policy in place that establishes our support of general supervision for all traditional, preventive, and therapeutic dental hygiene services. On behalf of FDHA, I express our support of the rules changes which were approved by the Board of Dentistry during your December 22nd, 2016 teleconference meeting. Thank you for your service to the citizens of Florida, and I also thank you for giving me the opportunity to speak.
Thank you. Board members, any questions? Okay, hearing none. Thank you.